Hello, my name is Zachary Dixon. Welcome to my presentation of Rocky Mountain Spotted Fever. Now, some quick history into learning the disease is it was first discovered in 1928 in the Biddeford Valley of West Missouri, formerly known as black measles, as indicated by its similar type symptoms of its rashes. And because of that, its resemblance and the uneducated wisdom thought it came from drinking and consuming melted snow water. Now, the crisis and the fatalities were 4 and 5 cases resulted in death, causing the citizens to cry to help for the state governor. This man, Dr. Howard Ricketts, was a pathologist in the University of Chicago, and he was the first to discover that the disease came from the transmission via the Rocky Mountain wood tick. In 1909, he later discovered the isolated bacterial organism responsible for this, and thus the disease was later named under him of Rickettsia rickettsii in the name of his honor. Now, some epidemiology is this disease is found within this region of the southeastern and south central United States of the American wood tick is formerly known as the Rocky Mountain Spotted Fever only because of the transmission via the Rocky Mountain wood tick, not the actual area within the United States geographical region. Now, some signs and symptoms of early stages and late symptoms can be nausea, fever, headache, and even vomiting. Later symptoms can be shown in 2 to 4 weeks, and even later stages, if symptoms are later prevalent, can be indicated by abdominal pain, diarrhea, and even joint pain. The most famous indication is the look of a rash, which can be starting in the palms or ankles. Starts on the arms and the ankles, which later can go to the palms and the soles of the feet. And the three major suggestive indications for Rocky Mountain Spotted Fever can be fever, history of rashes, history of a tick bite, and a rash. Now, some serology can indicate early onset symptoms from a PCR test of accurate diagnosis from 0 to 2 weeks. And IgG serology tests can be proved to be more accurate within the later stage of onset symptoms from 3 and even later stages of the symptoms. And it could prove to be 2 to 4 weeks, can be fourfold results. Now, some misconceptions can be seen in the symptoms, and if you are previously unaware of the tick presence or rash formation, and it is suggested that you go to your local doctor to go take a blood sample to correctly, accurately diagnose the disease, because some of the symptoms without the fever or without the tick presence or rash indication can be similar to dengue, Epstein-Barr virus, Lyme disease, influenza, and even typhus, and many, many more. Now, some etiology is the Rocky Mountain wood tick, the brown dog tick, the American dog tick is transmission vectors via the feeding on both humans and animals. An infected tick carrier can bite into the human epithelium, which causes a rapid entry of bacteria within the human, causing the bacteria to form an infection. Now, some pathology can come from the Rocky Mountain Spotted Fever tick-borne illness disease is caused by gram-negative coccobacillus, the Rickettsia rickettsii. After entering the body via the tick bite, the organism spreads throughout the bloodstream and the lymphatic system via infection of the bacteria on those organisms, on those body parts. The mortality rate is even greater in the elderly as their body systems are deteriorated over time with age. And fever and bradycardia become a present features on elderly, which cause the mortality rate to even go higher, as a rash is also likely, but the presence of it only occurs later. Some further images to provide the indication is these slides with the infection of the rickettsial organism producing a hemorrhagic rash on this left image of the internal organs of including the lung. In the center image, you can see vasculitis. In the third image, you can see the endothelial cells are swollen, and there's even mononuclear interstitial pneumonia seen on the photo of the right. Now, some organ systems that are infected can come from the vascular endothelial lining and the medium vessels throughout the body, causing systemic symptoms and high mortality rate if left untreated. Rocky Mountain spotted fever is the infection of endothelial cells caused by disseminated infection and loss of barrier function, altered vascular permeability throughout the body, and the bacteria attacks the cells lining the blood vessels throughout the body, which can involve the respiratory system effectiveness and the efficiency of the respiratory system via the blood vessel lining. The skin indicated by the picture on the right, as you can see the rash marks indicated altering the skin function and the blood, which even further affects the heart, brain function, and even kidneys. Now, some treatment can be seen here with antibiotics. Early treatment is also very necessary, as the mortality rate can be 20 to 30%, because our Rocky Mountain spotted fever can be very life-threatening, as seen in the previous slide, shown to affect many organ systems without being untreated. And the treatment course usually lasts from 7 to 10 days. Now, some prevention to know before you go outdoors is to treat your clothes, to know where to expect ticks, to use EPA-approved tick repellent, and avoid contact with ticks. Now, after you come indoors, it is very vital to know these key details of checking your clothes for ticks, checking your gear, and checking your dogs and animals that you might have for ticks. Shower after you go outside to wash off the ticks after being outdoors, and check your body and know which prominent areas to check your body, which are usually hidden without just a quick glance of your body, such as your nape, your armpit, within your ear, within the between of your fingers and between of your toes, your groin area, and your back area. And these are my sources. Some good sources are Hobson Medical. The CDC has a good article and prevention methods and treatment methods. Even the NLM NIH have a great resource further key detailing the illness and how it is caused. And that should be all for my presentation. Thank you guys so very much. I hope you have a great day.